It's a great pleasure to be here with you, with a vanguard of physicians who are going to save American medicine. I'm trying to think of the exact wording, so I'm not going to get it exactly right, but by Niccolo Machiavelli, who said the dangers of having mercenaries leading your army. If you have an incompetent one in charge, you are lost. And if you have a competent mercenary, well, then he's going to take you down next. We cannot rely on our mercenaries, neither our congressmen or our lawyers or anybody else, to save American medicine. If it's to be done, it's up to us. Something we've learned from all of this so-called healthcare reform legislation in Congress is that they don't listen to us. They don't read the bills. And I think it was probably Charles Schumer who, a good reason for not reading the bills. It doesn't make any difference. We could spend 2 days reading them, and then we'd still take a couple of lawyers to tell us what they say. But, it goes even further than that, that there's only a tenth of it there, that the rest of it is going to be made up by the administrative agencies. A number of excellent word counts have been done on all of the bills that have passed, and a couple of the two most important words, I think, are eligible and secretary. Eligible occurs too numerous to count, but there are things like you take your little card into this place, and they can tell whether you are eligible for a particular service from a particular provider on a particular day, particular facility. Well, if they're talking about eligibility, what does that say about universal access? There's also going to be ineligibility in the majority of cases. Or then secretary occurs more than 1,200 times, that the secretary is going to decide what's preventive care, what you get paid for, what you don't get paid for, and many, many, many medical decisions. Congressmen didn't vote on this bill on any other basis than threats and blandishments. The ones who voted for it, they didn't need to read it because it didn't matter what was in it. It doesn't even matter whether it's good or bad or whether they think it's good or bad. That doesn't make any difference. But the only thing that will make a difference to American medicine, that will save it for yourselves and for your patients, is, I think, a giant exodus. And it's starting with people who have spoken to you today, and I hope with many of you who are in this audience. Maybe we learned this from Gandhi, who eventually said, well, you may have my dead body, but you are not going to have my obedience. He didn't lead people with a bunch of pitchforks and so on. He just had people to say, we're not going to do this anymore. We are not going to cooperate with our destruction. We are not going to be slaves. We are not going to cooperate with bad medicine, to sacrificing our individual patients for the good of the collective. We're just not going to do it. Can you survive? I think so. I think you can not only survive, but you can enjoy practicing medicine again. And I'd like to point out the way in which the government may be helping us without realizing it. And some of my insight in this came from a dermatologist in Paris, Texas, named Richard Swint, who's been kind of a disruptive physician from way back. Dr. Swint didn't want to opt out of Medicare because he thought, well, my patients paid for this benefit, it's their benefit. So what he has them do is he has them file Form 1490S. And you can read about that in the February issue of the newsletter, and there's a link to www.hhs.cms.gov, or else that's the other way around. But there's a link in there, and you can look up Form 1490S. And it's a very, very simple form. All the patient has to do is put his name and his number on it and sign it and describe the nature of his illness. Doesn't need to have a CPT code book that will shovel money into the AMA's coffer. All he has to do is tell what he went to see the doctor for. The instructions form to it have an interesting statement that on this form that the patient files, you're supposed to tell whether your provider or supplier refused to file a form for a Medicaid-covered service or refused to enroll in Medicare. The courts have said over and over again that Medicare is voluntary, and now Congress has made it really quite explicit. To enroll in Medicare, it's no longer automatic, but you have to fill out Form 855I, which is a royal pain in the neck. You will definitely notice if you have to do that. Among the things that you will have to agree to nowadays is to give them access to your bank account. supposedly so they can put the money in when they pay you the benefits directly. That makes it easier and more cost-effective for them. But it's not just an innie, it's also an outie. And they can take out anything that they think might be an overpayment. So Dr. Swent has been going along. His patients have been filing to get their benefits. And believe it or not, a lot of times Medicare has been paying his patients their benefits. And then to comply with this mandatory claim submission law, 3 months later, just before the deadline, he files the form. And they never pay him. It's just a useless exercise to fill out the form and send it in. But he got a letter from them, and he's not the only one in the country to get this. He's just one of the first because he's such a troublemaker, threatening to revoke his Medicare billing privileges if he doesn't fill out all of those forms. And so he's asking, well, maybe that's a good thing. Maybe I shouldn't do that. And I think that perhaps he's right. And these are some of the questions that we're going to be looking into, because this PACO system that they're now starting up, that to be on it, to get payment from Medicare, you have to give them access to your bank account. And I think that may wake up a lot of physicians to say, well, you know what? Maybe we should go back to serving our patients and relying on our patients for our livelihood. Maybe they'll be thinking, maybe we don't want to be dependent upon a bankrupt for our living. And maybe we don't want to force our patients to be dependent on a bankrupt for their only source of medical care. Because people are finally beginning to wake up, although I'm not sure it's hit them quite in the head fully yet, that Medicare really doesn't have any money. And so probably ingratiating yourself with them is not necessarily what you want to do. So I'm hoping that even though the economy is in terrible shape and our body politic is in terrible shape and Congress is a mess, that it could be not just the end of the United States of America as a free nation, but the beginning of a new golden age. And I think it's largely up to people like you.